Awesome. Well, welcome back to everybody. So excited to have a very special guest on with us today. Dr. Geetinder Goyal has come into the Sound HSA studio, and we're going to talk about a lot of things as we think through health innovation today. And one of them at the forefront of that is direct primary care, which Dr. Goyal has spent a tremendous amount of time in his clinical career. Over many years, arriving at where he is now in terms of offering a care model that we think certainly is growing. We can kind of talk about maybe some of those statistics and trends, but relative to Sound HSA and really any HSA, we're obviously biased with Sound, but we think there's an opportunity to craft together and think about new health models for the individual and for businesses as they think about offering health benefit packages to their employers. So, Dr. Goyle, thank you for joining us. So great to see you.
Yeah, good to see you again, Stu. My pleasure to be here.
Awesome. Well, maybe we can start with a little bit of your background and maybe what drew you to direct primary care.
Yeah, I am trained in internal medicine, and then I did a fellowship in pulmonary and critical care medicine. So 3 years and 3 years. It was really during my fellowship I felt like I really saw the broken healthcare system unfold in my ICUs, basically, right? I felt like we could have done a lot better job as a healthcare system to keep people out of the ICUs. Um, and more our ICUs were becoming, I felt like hospice units where we were trying to constantly have conversations around end of life care. And, to me, it was shocking that in some cases, I, as the ICU doctor, was the first one to bring that topic up to a patient who was, terminally ill or really sick otherwise. And I felt like we were doing a lot of futile care in those ICUs. So just didn't see myself working in that environment, for several years. And I felt like something has to change. And really, I felt like our primary care system has to be functional again. It has to be relevant again, both from patients who go to primary care doctors' offices and our primary care clinicians who I felt like were leaving the system in masses because they were just so frustrated with lack of time or lack of control over their schedules. Um, so yeah, I was like, if I am to spend next 30 years of my life in healthcare, let's build something that makes sense that we can be proud of leaving behind for our own families.
No, well said. And so you've stood up First Primary Care, which is a growing medical practice in the DPC realm. Maybe a little bit about what differentiates First Primary Care. You talked a little bit about the vision, but maybe a little more about that, and really who do you serve primarily? Because you're across many states, right? This is not just a practice based in Texas, which I think you is where the was where the group is based. But you're now, because of telehealth, you can be everywhere.
Right.
Isn't that correct?
That is correct. So, I mean, the idea was, why are we insuring primary care, right? Like, insurance as a fundamental concept is supposed to cover risk. Primary care is not a risk, right? Like going to a doctor, getting your annual wellness, or knowing where you stand from heart disease standpoint or metabolic disease standpoint, cancer standpoint. Knowing all that is not risk. That is general preventative medicine, and we should not be covering it under insurance in the first place, right? Like, we don't use our car insurance to pay for oil changes or flat tires, right? Like, we use car insurance just in case we get into a big car wreck. And, there is not an insurance product we buy and hope to use. So why do we forget that in health insurance? So designing primary care on a membership based system made way more sense because it took insurance out of primary care, streamlined billing and collection, and it aligns the incentives of the care teams on the side of the patients. Because now, healthier we keep people, less of our time and resources they need or they use. So we are motivated to keep them healthy, educate them on how to keep themselves healthy, and reach out to us sooner when they do experience, sickness or concerns regarding their health. And then our goal is to get them back healthy. There is no other perverse incentive in the model. I don't get paid more by giving you 5 6 diagnosis codes, or majority of the care we are able to do now is virtual. Once I know you, it's so easy to connect with you via phone call, video call, text messages, and we get straight to the point because we already have a relationship, right? So primary care from clinician standpoint became a lot more enjoyable, and we could really use the knowledge and the skills we had learned over years and years of training to really make patients' life healthier and better, and then use insurance for anything, big bad ugly and unpredictable, basically. So that was our model. We started 10 years ago in Houston. We were first going to individuals who were frustrated with the healthcare system. We had a lot of 1099s who were getting crushed by rising premiums, gravitate to our model. But we have now developed a self-funded health plan. We call it WOOP care, waived out of pocket care. And our self funded health plan embeds the DPC model at the core of it. And most of our growth in the last 3 years or so has come from taking our self funded plan, DPC centric self funded plan, to employers, 50 employees or above, all the way up to 5,000 employees. So that's where our growth has come. And as you know, there is hardly an employer who has employees in one geographical area now, right? We all are all over the place. And so we had to adapt accordingly. So we have a virtual team that is licensed in majority of the states. And we are able to spend actually more time with our patients virtually than their, doctors do locally with them. We still work with the local doctors where we don't have physical brick and mortar locations, but still we remain the quarterback for for our patients who are on our health plan.
Yeah, as a DPC customer myself, I know the value of this model in terms of what it's done, at least for my health experience. But maybe for the viewers, the listeners, what the membership and subscription model at direct or at First Primary Care actually includes. What's the monthly fee? What's involved? Because a lot of people think they can't access this level of care, Dr. Goyle.
Yeah, yeah. Um, so I think pricing model does vary, from practice to practice, and that is one, part of it I like, because doctors are now able to set their own price, right? As compared to the insurance world, whereas the pricing is set by a CPT code, right? Which is, I believe, the wrong way of doing it. So pricing varies. We charge a flat monthly fee of $125 per month for unlimited access to your own care team. The care team has a capped panel, so you don't go above that number, and your goal is to develop, trust relationships with your panel, and be there as their advocate, as their counsel, as their primary care physician, quarterback of their health, to guide them to stay healthy. So for the most part, what we are doing is putting time back into a doctor patient relationship. I tell folks often that one of the biggest catastrophes in health is sending, folks to train for 7 to 10 years, and then telling them you only have 15 minutes to solve people's problems. Like, let the person who went to school determine how much time they need to solve a person's problem, not an administrator, basically, who is motivated by more volume and not the quality. Um, so in our model, time goes back into the doctor-patient relationship, which is what allows the whole relationship to flourish and get patients to be preventive first, proactive about managing their health and the conditions they have. Our
Yeah.
model does include basic lab work at no cost, 4 times a year. And then we also give our members access to about 1,000 generic medications at no cost, delivered to people's homes. So that is all combined under one flat fee. No additional cost, no copays. It just streamlines care on our end. I don't have to worry about, again, billing and collections, and patients don't have to worry about costs in addition to that when they need to reach out to us.
$125 for an individual, is, again, you've got to do the math on some of this. I think we've grown up in this system, most of us, that we've been disassociated as what we call the patient customer, which should be the patient customer, and the end provider or experience, thinking we can't afford healthcare. That's why we need insurance. Back to some of your earlier comments. And we've got all these intermediaries that have kind of now been littered and populated in the continuum. And really, when you distill it down, it is very affordable and you can have high quality care. One of the things I was amazed when I first did a DPC visit was the physician spent an hour and a half with me
Mm.
and doing a thorough kind of an intake, but he just really wanted to know about lifestyle and family and prior health. And, it was just, in addition to the physical exam and the physicals and the blood work, it was just really getting to know who I was,
Yeah,
which I just thought was amazing.
yeah,
Um, just absolutely what it should be.
yeah. No, I mean, I think we get that comment very often, even when, I'm connecting with folks virtually all over the country, that you have spent more time with me on this call than I have spent with any doctor in person over the last several years, basically. Um, so yeah, you're absolutely right. It's magical when you put time back into the doctor-patient relationship.
Well, everybody's quality of life improves, right? The providers and the patients, right? In
And
that scenario.
yes,
Yeah, for sure.
and I
So,
think
Doc,
that. Sorry, John, go ahead,
yeah,
please.
go ahead, Dr. Goyal. Continue.
I was just going to add that I think the big sort of what DPC physicians, clinicians who are doing this are doing is also bringing transparency back into healthcare, right? And I think that's a big deal because nobody knows what care costs anymore. And I think until unless there is transparency and conversation about actual cost of care, we are not going to solve the healthcare crisis we are in. And I think DPC doctors are spearheading that transparency movement as well.
Yeah. One more, John, before you get going. One other question. So, for example, like an MRI, right? Someone visits with you or one of your providers, and they need an MRI. Obviously, that's beyond the scope of the DPC membership. How do you guide those individuals to find maybe? I don't know. We're going to get into high deductible health plans and so forth further in the conversation. But how would you guide someone? Are there, do you have contracts where you've negotiated or can help guide that person if they're needing a more extensive scan or test?
Yeah. Um, no, excellent question. So first of all, we find out, what do you have as catastrophic coverage? Do you have anything in addition to direct primary care, right? So if you have a high deductible health plan, we can try running it through your high deductible health plan and see what that MRI costs. But typically, insurance costs are way overpriced than, let's say, a cash pay price for the MRI. So our preference is to generally buy care on a cash pay basis. When we first started in Houston, Stu, we went to imaging centers and said, "Hey, can you give us your cash pay price?" And they gave us a whole list, right? Like ultrasound, CTs, MRIs, X-rays, and it's like a full menu basically, right? And an MRI used to be about $450, a simple MRI, non-contrast. But then we would take that list and go to another imaging place, and they will beat that price. And now we have 8 different imaging, companies, at least in Houston, competing for our business, and they compete on quality and price. We send our members to where we get high quality service, quick appointments. I can call the radiologist if I need to, and we get a good price, right? So because we started talking about price, quality and actual price, or value, became actually a conversation. In the insurance world, when you don't know what it's going to cost, there was no way to have the value conversation, basically. And so oftentimes in our world, members choose to pay cash for these exams. We have several imaging places we can go through. Again, we constantly pick the top 2 3 high quality ones with good price, and we don't really have to negotiate. We just have to ask what the price is, right? And we move forward, basically. People who have high deductible health plans that are combined with an HSA obviously can pay using the HSA dollars directly to the imaging place, and we move on, basically. No prior authorizations and stuff required, typically, that insurance companies make us go through as well.
Sorry, John, you want to say something?
Yeah, and I think everything you've shared, Dr. Goyal, is really, really informative. And I think for folks on the call who have dug into healthcare at all, they might realize, the huge pain point and issue is around not having transparent pricing in healthcare, and how important that is just to even ask for the price. And I think direct primary care, as you mentioned, is really an amazing tool for an individual, because now you you as a DPC customer, you are the customer patient in that relationship building with the doctor. You know what that monthly fee is going to be, and getting valuable care. And so I'm curious now too, and you started mentioning on the HSA, and obviously we're biased here from Sound HSA, but we know that, and there's even a lot of HSA education that needs to happen for direct primary care doctors. We were at the HINT Summit earlier this year, and there was a lot around there. And with the new Big Beautiful Bill legislation, right, up to $150 per month for individuals can be eligible for direct primary care. So maybe you can speak a little bit to the benefit of pairing that HSA now with, you still need the high deductible health plan, but with direct primary care, and some of the advantages that can give to an individual or family looking to ultimately take responsibility for their health, right? Not have a third party that's responsible for them, but to say, no, this is what I need to do to really take control of my health.
Correct. So I'm a big fan of health savings accounts, right? I think they need to be a little bit more deregulated. We have obviously taken a step in the right direction by allowing HSAs or HSA dollars to be used for purchasing DPC. But I think it would be even more beneficial for everyone if we can decouple HSAs from a high deductible health plan, right? Like if I want to use or open a HSA and start putting money into that HSA for future use to cover my healthcare expenses, I should be allowed to, without having the stipulation of combining it with a high deductible health plan, right? Because I just want to self-insure myself. I want to keep growing my HSA as self-insure, and maybe I will buy a catastrophic plan, but I have a $10,000 deductible, or a $20,000 deductible, and if over the year I haven't used my HSA, I want to build up that fund and decrease the amount of insurance I'm buying for my catastrophic care, right? So I really see ideal sort of stack as 3 components, right? One is your primary care component, which I call your day-to-day care, your team that you have access to, that knows you, that keeps you healthy, right? That's like a Netflix membership, basically, that you buy, right? Then you have the middle layer, which is, and I'm sure we're going to get into, is our, tax advantaged health savings account which is a mechanism for us to start self-insuring ourselves as much as possible, right?
Mm-hmm.
And then the third layer, obviously, is the insurance layer, which we buy just in case, to protect ourselves from any catastrophic events, right? That could cost maybe tens of thousands of dollars. So that's kind of the stack I see ideally, you know, working out for everyone. Um, so, the legislation that was passed by Big Beautiful Bill to allow HSA dollars to purchase DPC, I think definitely a step in the right direction. And hopefully, we see growth of HSA high deductible health plans, and folks using those HSA dollars to invest in their health, to get a.
Yeah, absolutely, Dr. Goyle. I think that's a great. That stack is. We should definitely create a visual around that because I think that it's really important for the individual to see. Hey, I have my primary care, and then I have this ability, and right, and what we're doing in enabling Bitcoin within the HSA, having that tax advantage savings for yourself, and then ultimately, yeah, there could be catastrophic events and things that we need insurance for, and really the purpose of insurance. Maybe you can speak a little bit then to the someone who's listening who is looking out, as an individual. Maybe you're on the marketplace, and there's roughly 20 million people getting ACA marketplace plans for their own insurance, and maybe being able to stack the HSA and DPC with it. You can speak to what you see from the individual side in your clinic, but can you also speak then to the employer side when you're doing a lot? When you talk about self-insuring, I think the individual can do that with the HSA, but what does that look like also then for companies who can get better value by self-insuring for their people? Just as an individual, you can get a better almost self-insure yourself and your future needs by saving in your HSA.
Yeah. So on the individual side, definitely if you are interested in opening an HSA right now, we still have to pair it with a high deductible health plan, right? Like I just cannot go open an HSA account and start contributing, dollars to it. So for individuals, I certainly recommend picking a ACA marketplace plan, high deductible health plan, that is HSA compatible. Um, and obviously, which plan to pick there on the individual side will depend on the needs of the individual, how currently their health is. Do they have any existing needs healthcare wise that they need to be taken care of? So there could be some nuance to picking the right kind of exchange plan, for an individual. But correct me if I'm wrong, but I think the limit for the deductible to qualify for an HSA is about $2,500 or $3,000, I believe.
So for an individual this year is 1,700, and for a family $3,400 deductible.
Yeah.
And I feel like you hardly see any plans that are lower deductible than those, right? So pretty much every plan should qualify for an HSA. Um, and then contribute into your HSA, and certainly it makes complete sense to me to use those HSA dollars to find a DPC practice to get your primary care from. Um, so that's on the individual side, and obviously, again, my dream would be to decouple that HSA from the having a high deductible health plan, because then I feel like, models like medical cost sharing, right? There are several companies that do cost sharing can come into the play, because cost sharing is a great way to, get catastrophic coverage. But right now, I cannot open an HSA if I participate in a cost sharing, which, I don't see why not, right? Like I should be able to still open and contribute to an HSA, have a medical cost sharing as that third layer, and then obviously, get a DPC doc. Um, so, obviously, our bread and butter is more employers going, or taking them to level funding or self funding, insurance plans. And there we can be creative about how we want to do the plan designs. Um, I think I was sharing this with you guys that we ourselves are about 60 employees now on a self-funded health plan, same health plan that we sell out there. And we are looking into, um, starting a sound HSA for our own employees come next renewal, where our employees will still all get DPC at no cost to them. But then what we want to do is have a deductible, let's say $3,000, but the company contributes 1,500, and we encourage the employee to contribute 1,500. So you have the deductible amount in your HSA in case you meet it. And then obviously above 3,000, the plan picks up again to pay your claims, right? So that's the stack I envision for our self-funded plans going forward. Um, there are still some laws around, that you cannot provide first dollar coverage if you have an HSA. And again, I feel like those things, if go away, it will allow the HSAs to flourish a lot more faster.
Yeah, and we would obviously encourage and would push for legislation that decouples the specific type of health insurance plan you have with the HSA. We also we believe in the individual to be able to have that triple tax advantage, and maybe there's a trade on not having triple tax advantage. Maybe it's still double tax advantage to make the numbers work from the budget office, but ultimately removing that tie so that an individual and family can plan on what's best for them. But ultimately, where the market sits today, you have 150 million people getting commercial sponsored health plans from their employer. So I think what you're doing in the employer space is also really interesting and eye-opening and cutting at some of the root causes of what's broken in the healthcare system. And a lot of that is commercial plans ultimately having higher and higher costs, as you mentioned, and paying 250% more for the same good or healthcare service like an image compared to what Medicare and Medicaid are paying. And so it's the companies and then ultimately the employees that are footing the bill for a lot of the rest of the healthcare system. And at least for me personally, when I started out doing strategy consulting for health systems, worked in Medicaid, worked in medical supplies, and ultimately it wasn't until asking the question, what is money, to where I started seeing, okay, healthcare is broken because the money is broken, right? And you mentioned we don't have price transparency. We don't have people knowing, even producers really knowing what the cost of something is going to be. It's just some discount compared to that charge master price, or if you're in the hospital setting. And so we've obviously connected a lot over Bitcoin and understanding sound money, but would love to hear your own perspective too, and how you think the money, the brokenness of our money, of fiat money, has led to some of the challenges we see in healthcare, and maybe what brought you to Bitcoin or even sound money more generally first, uh, and how we can potentially use that here in the healthcare space with all of your expertise.
Yeah. I'm relatively new to the Bitcoin world. Probably last 2 years, I have really gone into it. And my introduction to Bitcoin was um, the book Bitcoin Standard by Saifuddin, right? And he does a really good job of explaining the history of fiat money, and why fiat is just doomed to fail no matter how you slice or dice it. And that's because of the inherent problems with the fiat money of government being able to print it and devalue it, whenever they want. Um, and you know that fiat money is root cause of a lot of problems in the world, not just our healthcare inflation. I actually believe that we can achieve world peace if we fix money. And So when you start thinking about it from that standpoint, and then you start understanding the qualities what make Bitcoin Bitcoin, you realize that properties of Bitcoin are very different from the properties of fiat money, because it's limited supply, nobody can reprint it. So the pressure is not inflationary, it's actually deflationary, right? So what you hold grows over time instead of fiat, which, you know, decays over time, basically. Um, so yeah, I mean, strong believer in the concepts behind Bitcoin, and want to do whatever we can to support the adoption of Bitcoin, as a means to do transaction or as a means to store value.
Yeah, you've and, hopefully the mic issue is gotten a little bit better on the feedback on my side. But Dr. Goyle, you talked about some use cases for Bitcoin. One of the products that we offer is Move to Earn. It's something that your practice has used as an incentive. So earning Bitcoin for steps in someone's daily or weekly walk as they function just in their work life, to be
Yeah.
able to reward people for, you know, something like taking enough steps. You know, that I think the data show that, 7,500 steps is kind of the early threshold towards meaningful reduction in all cause mortality, based on some research. So something very simple as just consistent walking on a daily basis at that volume. Maybe speak a little bit about some thoughts there and your early experience, at least with Move to Earn.
Yeah, I mean, when I first heard from you guys, I immediately liked it, and again, it was a way for us to show our employees, what we stand for, what we want our culture to be, right? We want it to be a culture of health, right? And we are a medical practice, and if we don't live what we preach, what are we doing? So this was a little fun way of creating a group activity amongst our employees, to earn sats or Bitcoin when they complete 50,000 steps on a weekly basis. And, now I see people tracking their steps, and they'll be like, oh, I got 2 more days to do these many steps. So it's definitely leading to people walking more. Um, and yeah, we used the Sound HSA app to track all that, and to create a FBC group where we can see all the members completing their weekly challenge, and getting rewarded with I believe 10,000 sats on a weekly basis. We're given as a reward. um, so that was one aspect of it, right? Just promoting health, and creating a culture of health. But second aspect to it was um, giving people exposure to Bitcoin, because again, most people have not taken the time to fully understand it. They have heard about it, but they don't really understand it. So this was again one way to bring people closer to what Bitcoin truly is. So yeah, I think we've been doing it for almost 6 months or so. We want to continue doing it, and we are brainstorming on how this can actually be, the Move to Earn challenge can be brought into our health plans as well. Because we've had conversations with a couple of employers who are more, again, want a culture of health within the company. They like this kind of idea, a ton. And it doesn't have to be just steps, right? What we want to do is maybe reward people with sats if they complete certain, like onboarding with our clinic, right? When you are on our plan, we want to know what your health is today so we can make it better, 1 month from now. But we can't do that until you complete your onboarding with us. So we have talked to employers about, if you complete certain onboarding steps, you get rewarded with sats basically. So we hope to build on kind of the move to earn challenge in other ways as well.
Yeah, we love that, and I think that creative approach is really needed to improve health outcomes overall in a population where we see 6 in 10 with a chronic condition, and you look
Yeah.
around and there's a lot of just unhealthiness of the general American population. So yeah, you've been a standout, and you're at First Primary Care, dishing out more than 4 million Sats to date. So keep the Sats flowing for steps, and I think to your point, it's really just shows what's possible. And I'm curious from your perspective, maybe from metabolic health, or like what other metrics or data out there, and individuals maybe listening to this, should they be tracking or can they track over time to know, hey, I'm moving in the right direction for my health. Steps is a really obvious one. We're humans. We need to move our bodies, get sunlight, get outside. But what else do you think, and from maybe coming back to the DPC perspective, what do you look for from an individual to work on over time?
Um, I mean, there's a lot to it, right? But to sort of summarize it, we generally, I share, and I've stolen this from Dr. Peter Attia in his book called Outlive. He talks about four horsemen coming to kill us. Number one is metabolic disease, which a lot of the times leads to the other three horsemen, which is heart disease, number two, cancer, number three, and neurodegenerative diseases or dementia, number four, right? That these four are more so lifestyle diseases, and they are still the number one, like combined four killers. And there's a lot we can do to prevent those. So when we are visiting with individuals, first is building and knowing you based on your family history, your medical history, then your blood biochemical analysis, any imaging we need to do to build a complete picture in terms of where you stand from all those four horsemen standpoint, right? Which one needs to be priority, and how do we start building your defense mechanism to fight against those four horsemen? Um, we talk a lot about four foundational pillars of health: sleep, nutrition, exercise, and stress. So when we are talking about strengthening your defenses against four horsemen, those are the four things we need to really optimize for initially. It's not medications, it's your pillars of sleep, exercise, nutrition, and stress, right? um, and then comes, okay, what else we need to do? Do we need medicines to attack something beyond just those four pillars? um, so yeah, I mean, a lot goes into building a profile, but a systematic approach like this, it gets people engaged. It gives a very nice framework for my clinical teams to work within. Um, and obviously, DPC model allows the time to actually do it.
Yeah, that's
Absolutely.
amazing.
Mm.
Yeah, yeah. Back to kind of the rewards and the incentive structure around for Bitcoin. This intersection of sound money and sound health. So much is there in terms of overlap. And one of the things John and I got excited about, the move to earn piece as an incentive structure. We that was always an original vision of our company and what Sound HSA was going to be about. Even though the earn piece, at least under current legislation, is outside of the regulated HSA product, but our hope was and is, and we've seen it, is that some people's first Bitcoin they ever hold is Bitcoin they earned. And we just hope that we can continue that as a corporate wellness strategy for anybody that's participated in one of our global challenges that we've done over the last, year to year and a half. We've rewarded so many sats for people just for movement. And for many of those people, that was probably their first Bitcoin as well.
Yeah. Yeah, they would have never bought it otherwise. So yeah.
Yeah, and then in our HSA experience, now we're putting real Bitcoin for individuals in multi-institutional, multi-signature custody, with our partners, Horizon Trust and Unchained and Gannett Trust. And where we're moving towards, and where we think it really gets even more interesting when we talk about value for value connections in healthcare, and where there are middlemen taking cuts of every transaction, right? 6 to 10% of every healthcare transaction goes to a middleman, EMR, billing. You've a quarter of the $5+ trillion a year in spend is administrative, and half of that's waste. And we're gearing up to now be able to distribute in kind in Bitcoin, and pay for goods and services in kind. And we think that direct primary care, DPC, and for clinics that are accepting Bitcoin, that can really complete that loop now of using Bitcoin for a long-term savings vehicle. But then ultimately, as we shift more into using it, and with our limited time here, but using as a medium of exchange to then benefit you as a practice. So we know you are accepting Bitcoin now via Zaprite. Maybe you can speak a little bit to that decision. And we know that, at least to start, the number of people looking to pay in Bitcoin for DPC might be limited. We believe we're coming with a cohort of individuals who will want to do that. But then ultimately integrating even more into the tools you're using today to make it seamless for your staff and in clinics across the country to be able to integrate Bitcoin. But maybe you can speak to that a little bit and where you think we can head with it.
Yeah, I think, once you start understanding Bitcoin and realize, why it's sound money, I think it becomes a no-brainer to say, yes, I will accept Bitcoin. I would love to take more and more transactions in Bitcoin and move away from fiat. Obviously, as consumers, the knowledge gap is still there, and I think our markets still have to mature to really sort of see that vision come true. But for us, we've been pioneers of a lot of things, and this was a no-brainer for us to basically at least be ready to accept Bitcoin and from whoever wants to pay in Bitcoin. And then obviously technology has come a long way to allow practices to be able to do that. Um, so yeah, I mean, interesting to see how that goes. That's a pretty recent development. We haven't done a whole lot of marketing or anything like that yet, but I'm excited to see how that pans out. And like you said, you guys are the first HSA, Bitcoin backed HSA, and now you can pay for DPC with your HSA dollars. So hopefully we see some momentum on that side as well.
Yeah, Dr. Goyle, on that, there is a kind of a nuance to using TPC out of your HSA. There's a fixed amount that a family or individual can use out of their HSA to pay for direct primary care, and your fee is certainly within that monthly number. And so your model at your facility and your practice is definitely tenable for someone to pay for their entire membership experience out of their HSA according to IRS guidelines, at least
Right.
as of now.
That is correct. Yes.
Yeah.
And what would you say to maybe other DPC docs out there, your colleagues? We've interacted at several with several of them, whether at Health Rosetta or Hint Health or others that we see really trying, advancing healthcare, and from a values perspective, are very aligned with our message as well of uh, really creating that patient doctor relationship, cutting out middlemen, ultimately moving towards that individual proof of work. Uh, but maybe haven't gotten there yet in terms of Bitcoin. What would you say to those docs out there?
I mean, same thing like you're saying, John. I mean, this is a natural alignment, right? DPC is all about, proof of work and, um, sound health and transparency. And that is exactly what Bitcoin stands for. So, a lot of similarities between what DPC is trying to do and what the intent behind Bitcoin is. So I really hope that we can bridge some of the knowledge gap and, DPC docs who are already championing the change in healthcare sort of continue to evolve into, you know, thinking of money also as a problem that we need to solve, right? That just solving primary care is not the end of the story. There are other things to fix as well, which is one of the reasons we got into our health plans, because we wanted to solve the insurance problem as well, not just the primary care problem. Um, and again, super passionate about bringing sound money for everyone involved. Hence, and we love what you all are doing on the Bitcoin HSA side.
Well, we certainly appreciate your time today, Dr. Goyle. If people want to learn more about you or your practice, where should we send them? Where
So
can
our
they find you?
website is firstprimarycare.com. Then our health plan website is whoop.care. So WOOP dot care. Waived out of pocket is what Whoop stands for. Uh, Nothing to do with the wearable Whoop. So yeah, those are the areas where you can learn more about us. But I'm on LinkedIn often. Um, Trying to get myself to be more active on X as well. But LinkedIn is certainly where people can find me, and we can connect. Yeah.
Awesome. Awesome. Well, thanks so much for joining us today, Dr. Goyle. And we look forward to joining you at the Midwest Bitcoin Summit in September in
Absolutely.
Columbus. I know you have a clinic out that way as well in Ohio. And so we think, we really love all the work you're doing and appreciate working with you on really trying to advance sound money into sound health. And as you said, there are many problems out there, whether it's primary care or insurance or ultimately the money that we see as a lifelong endeavor here. But as many folks with your level of experience and clinical expertise and also approach to medicine that we can have, I think we'll really make a huge impact in educating individuals on how and even just the pillars you mentioned. How can you take responsibility for your health? Because ultimately, that's what we see in Bitcoiners who are asking and seeing, hey, here's how I take responsibility for my money. And then the next step, as you can afford more time to do the things you want to do, maybe outside of work or with your family, that you do that in good health. So thanks again for joining us. Look forward to seeing you again in person here soon. And yeah, keep up the great work.
Absolutely. Enjoyed the conversation. Thank you for having me, and definitely look forward to continuing the collaboration and doing the good work.
Thank you.
Thanks, Dr.
Thank
Goyle.
you.
Take
See ya.
care. Bye.